I'm going to give you 3 minutes.
Okay.
Do you want 3 minutes or 4 minutes? Three. So
Uh, the
we will
management part.
practice on the less, time frame that you can get. Maybe you can just waste some time in the history taking. Usually, the case should be four for history taking and four for the management. Four for the data gathering, not the history taking. For the data, 4 minutes for the data gathering. By that I mean history taking, examination, and investigations.
Sorry, doctor. The Zoom app disconnected, so I couldn't really hear you. You come again, please?
Um, what was the last word that you heard?
We're going to practice. I'll give you 3 to 4 minutes. That was the
Yeah.
last thing I heard.
Okay. So, do you want 3 or 4 minutes?
I guess three, so
Yeah,
I
I prefer three. Just, sometimes people don't do it like 4 and 4. It should be four for data gathering and four for the management. But sometimes people waste time. Sometimes the simulator gets time to just open up with you. So I'm going to give you 3 minutes. Okay?
okay, doctor. And I'm supposed to start with the diagnosis?
No, yes.
Okay.
I'm going to tell you now.
Okay.
Um, do you want to start by giving the management without us thinking together? Okay? Or do you want us to think together about the management and then you give me the management? What do you
Uh,
prefer?
I guess I'll start on my own and you could
You
correct me.
want.
Okay.
Okay. All right. No worries. Okay. So I will give you 3 minutes, and the management, please, doctors, should not be less than 3 minutes. Okay?
Okay.
Don't give the management 2 minutes. You will not have time for everything in the management.
Yeah.
Okay?
Mhm.
The perfect thing is 4 and 4. Yeah? Let's do it in 3 minutes. Okay. Um, listen carefully. All right? Case
Okay,
one.
doctor.
Case one. Alex, 40 years old, had a fall,
Okay.
tripped while leaving the restaurant, landed on his head, had loss of consciousness, vomited twice, and has headache.
Okay.
Examination findings: blood pressure is normal, normal neurological examination, clear discharge from the ear, no investigations done yet.
Okay.
All right?
Yeah.
You have 3 minutes starting from now. From you give the diagnosis and the management part. I will have some concerns. I will perform as if I am a simulator doing the
Okay.
only the management part with you. Okay?
Okay. Yeah.
Ready?
Yes, doctor.
Start.
Thank you, Alex, for letting me examine you. So Alex, by examination, I found that there was fluid coming out of your ear. All right. And this combined with the history that you've given me, you mentioned that you had a fall. It was a trip, and then you lost consciousness and you vomited twice.
Mm-hmm.
So this part is very concerning to me. Uh, are we okay so far?
Yeah. What are you concerned about, doctor?
Okay, what's concerning me is that there could be a fracture in your skull.
Oh, really?
Yeah, it is serious and this needs immediate management.
Oh my
Would you
God.
like to hear what we can do?
What are you going to do, doctor? Then?
Okay, for starters, we're going to keep you in, and I'm going to involve the neurology specialist. He would request some imaging to figure out what's happening and where exactly is the fracture.
Okay.
Okay, and don't worry, you're in safe hands, and you did the right thing by coming here today.
But
Uh,
but but
yeah,
doctor. Well, I don't think that this is serious, doctor. I just want to go home. It's just some headache.
that is totally understandable. If it was only for the headache, then yes, I would agree with you. But however, you did vomit twice. This is highly indicative that there is a skull fracture.
Okay.
And if you were to go home, then it's not safe for you. You could potentially put your life at risk. This needs management in the hospital.
Oh, oh, I was not expecting that at all, doctor.
Is there anything that we can help you with? Is there a reason that you don't want to stay?
Um, how much will I stay then, doctor?
Well, for now, I couldn't give an estimate, but what I'm sure of is that you are probably going to be admitted in for today.
All right.
Is there anything we can help you with? Is there something you need to get back to? We're here.
No, doctor. No,
Is
no,
there someone you'd like to call?
no, thank you.
Okay. Don't worry, you're in good hands. And for the headache, we'll give you something, and also for the vomiting, we'll try to make you as comfortable as possible. And if you feel any pain or um, anything, anything you'd like to ask me about at any moment, please feel free to ring the bell.
All right. Okay, time's up. Thank you. Well, okay. Well done. All right. Well
Doctor.
done. Okay. Good. How do you feel?
Well, I feel like starting with only management doesn't really give me time to get used to the patient. So I
Okay.
was, yeah.
But you you were talking with me appropriately, and you were asking me what do I think about and these things. So yeah, okay. I'm going to comment on that after we practice with the next doctor.
Okay,
Okay.
doctor. All is, yeah, thank you.
Yeah, just bear with us. All right. Who is the next doctor? Dr. Yumna, I think.
Yes, doctor.
Okay. Dr. Yumna, do you want me to read the question again or you?
No, I've written the information, so
All right.
already know. Yes.
Okay. Uh, yeah, I didn't write anything about the case here, just to prepare you to the for the exam. In the exam, you will not have anything to be written. Okay, just the question and nothing else. So you have to prepare yourself, without pen and paper. Okay,
Okay.
but because you are starting, it's fine. Yeah.
It's
All right. 3 minutes. Okay.
okay. Okay.
Alex, 40 years old. Yeah.
Okay. Thank you, Alex, for letting me examining you. Okay, from my examination, all things are okay, except from you have a clear discharge coming from your ears. So this is with the symptoms that you have mentioned to me, making me concerning about something called fracture in your skull base. Have you ever heard about this condition?
Fracture. Do you mean fracture in the bone, doctor?
Yes, unfortunately, this is the concerning me right now.
Oh my God.
Mhm.
Uh, all right. What are you going to do for me now?
Okay, Alex, this is a serious condition, I'm afraid, and we have to be as safe as possible. And we, can you hear me, doctor?
Yes,
Because,
yes.
yeah. So this is a serious condition. It might be a life-threatening condition. So we cannot send you home. We will going to admit you in the hospital. What do you think about this?
Admission. Well, I
Yes.
don't know, doctor. I was not expecting that. It's just headache, doctor. I'm fine. Just let me go home.
Okay, I see that you are shocked about this information, and it's totally understandable. But if we can help you in anything in home, we can do this. But your safety and health is our priority. So,
What do you mean by that, doctor? It's just headache. I don't have any problem. Just headache.
Okay, I can see that you are concerned, but we we need to involve the neurology team. Also, they will make more investigations to and main imaging, to just see your head and your skull and see if okay, and see if if everything is okay. But we here in a serious condition. So, what do you think about this?
Again, doctor, I was not expecting that, to be honest.
Oh, well, I'm glad that you are here in hospital after this fall because you are caring about your safety and your health. And this is what we are caring about too. So, what do you mind if we can help you in anything that you want outside of the hospital until we make sure that everything is okay with you? What do you think?
Well, nothing, to be honest. I was just, how long will I stay in the hospital?
Well, at this moment, we can't tell exact duration, but we can, after investigations and the imaging.
Time's up. Okay. All right.
Mhm.
Thank you, Dr. Yumna. How do you feel?
I don't know exactly, but at least I intended to tell some info, so that's okay on me right now.
Okay. All
Thank
right.
you.
Okay. No worries. All right, doctors. Okay. So let's think together first. What could be the proper management in this case, and let's see how well Dr. Noor did and how well Dr. Yomna did. Okay? What is the diagnosis in this case?
Skull fracture.
Skull fracture, and what else? The patient might be having something, concussion or something in his brain. Okay? So maybe there's some damage or something happening in his brain with the skull fracture. Okay? Okay, if we think about the management, here, where is that? Yeah, the diagnosis is skull fracture and maybe concussion or an injury to the brain. Okay, both of you just said skull fracture. Okay, this is the diagnosis. What is the immediate management? The immediate management, CT head, neurology referral, monitoring the patient, and painkillers. Okay? Do I need to think about the ongoing management now in this specific case?
Acute.
Yeah, no worries about the ongoing management now. Even the future management, because the patient is asking few questions and showing that he doesn't really understand the seriousness of the condition. Yeah, so you have to give time to the questions and concerns in this case. All right, so if we think about the management, it's about the immediate management, answering the patient's concerns and addressing the patient's concerns, and show some communication skills. All right. Okay. For doctor, he was asking few questions. What are the questions and concerns? What's going on with me, doctor? Yeah. What are you going to do for me? And lastly, it's just headache, doctor. I don't think that this is something serious. I just need to go home. Right? How to answer in this question? Okay, he just think that there's nothing serious. He's okay. He doesn't have anything apart from headache. It's just headache. Just let me go home. So, the most logic thing is asking, is there any reason that you want to go home? Okay? And then explain the seriousness of the condition. Even if you explained it before, you have to explain it again. Okay? Explain it simply to the patient again. Tell him, as I mentioned to you, Mr. X, this is a serious condition and this is emergency and it is unsafe for you to go home. Is there any reason that you want to go home so we can help you with? So either explaining the seriousness and then ask him why, or ask him why he wants to go home and then explain the seriousness. This or that, both of them are correct. Okay? So we have talked about the immediate management, we have talked about how to answer the questions and the communication skills. What are the things that you have to show in this case in the management? You have to show the urgency, okay? And you have to support the patient or to reassure the patient. It's good, the good thing that you are here with us now. Don't worry about your health. Everything will be okay. We will do our best to help you. And if he has a concern regarding going home, he doesn't have a concern. He's just want to know when he's going to go home, okay? And the answer, to be honest, we don't have the exact estimate now. But the most important thing is that we have to keep you in the hospital. Okay? All right? So we thought together about the things that we have to include in the management. If anyone who don't do that or miss an important point, either in the immediate treatment or answering the patient's questions, or was having poor communication, the management is just incomplete. Okay? All right, Dr. Noor, you explained to me the diagnosis, but please just tell him we also afraid that you might have a concussion or something going on wrong in your brain as well, because you vomited twice. Okay? The patient might be having bleeding, right? Not concussion, maybe bleeding. You don't know. Okay? So complete your diagnosis. It's not only fracture. Yeah. You gave me the immediate treatment. CT head, you said imaging.
Yeah, to explain it to the patient.
Some scan on your head called CT scan.
Okay.
Okay. You said neurological referral. You didn't say monitoring.
Yeah.
You gave me painkiller, which was good.
Okay.
Okay. So frankly, CT head and monitoring, please. Okay. And vomiting, anti-sickness medication. All
Yeah.
right. You said that. You answered my questions, to be honest, all of my questions, and you explained the seriousness again. Yeah, you showed the urgency, and you were trying to find out why do I need to go home, or why I don't want to stay in the hospital. Okay, so if I say something or I give you marks, I would say 3 to 4 in the management in this case.
That feels good to hear.
Yeah, you've done everything. You answered my questions carefully, properly and correctly. You were supportive, and you dealt with the concern. He doesn't understand the seriousness of the condition, so you were able to do that. You were able to explain the situation again and tell me that this is serious and it's unsafe to go home. Okay? All right. In terms of Dr. Yomna,
Yes, doctor.
You told me you have something called fracture fracture base of the skull.
Yes.
Okay.
Mm-hmm.
Well, they know fracture. Okay.
Mm-hmm.
So tell him, well, we are suspecting that you might have fracture in the skull bone. Okay.
Mm-hmm.
Also, because you vomited, there might be injury to your brain causing this vomiting. All right. Don't say you have something called if the patient knows what is this term. Did you get what I mean?
Yeah.
Okay. Let's say, Mr. X, you have something called infection in the chest.
Mm-hmm.
It sounds awkward, right?
Yes.
Okay, so always give the diagnosis in a natural way. They know what is the fracture.
Mm-hmm.
Okay. Then you told me it could be life-threatening. I would say, well, this condition is serious and needs urgent treatment. Okay, to avoid any further injury or damage to the brain. Better than life-threatening in this specific condition or this specific case. All right?
Okay.
Okay, Dr.
Yum.
Yeah.
Yes.
Then you showed me the urgency, and you showed me that this is a serious condition, and you admitted me in the hospital. You said imaging as Dr. Noor. Please say imaging as a scan on your head called CT scan. Okay?
Okay.
You involved the neurological team. You didn't say monitoring, and you didn't give me painkillers.
Okay.
For the headache. Okay?
Mm-hmm.
All right. So monitoring and painkiller, please, and also for the vomiting anti-sickness. Okay.
Okay.
This is what you missed. Yeah. When I told you, doctor, I don't think that this is a problem. It's just headache. You told me. I can see that you are shocked, right?
Mm-hmm.
He said that. Well, he's not shocked. He doesn't understand what is the situation. Okay? So you tell him, I do understand, where are you coming from? Okay? And explain again. You didn't explain the seriousness. You told me, but we have to keep you in the hospital. Okay? You tell me, well, I do understand where are you coming from, but this condition is an emergency condition, and we have to treat you in the hospital. This is for your safety. Okay? Explain again. Explain again. Maybe he doesn't understand. Maybe he didn't pay attention at the first time that this is a serious condition.
Mm-hmm.
Okay? Got me?
Yes.
All right? So if he doesn't understand, explain again. Yeah?
Just saying your safety and this is an emergency condition, right?
Yes. Yeah. Yeah. Is this an emergency condition, as an emergency situation? Yes, it is an emergency. So you have to frankly say to the patient, this is emergency and it is unsafe for you to go home.
Okay. Mm-hmm.
Something else I told you, I put something regarding listening, maybe because you didn't explain again. Yeah, you didn't explain again the the situation.
Mhm.
Okay, so in general, you've given me part of the diagnosis. You give me the immediate management without painkillers and monitoring. Please think about the holistic management. All right. You answered one of my questions, the estimate time. The other one, I want to go home, is just headache. You didn't explain, or you didn't comment or answer this concern or address this concern correctly. Okay. What else? Yeah, these are the things that you missed. Okay. As a start, I know Dr. Dr. Yumna, you are starting. You are doing great.
Thank you, doctor.
Are doing great. It's just about, finding the proper phrases to use, or the proper answers to use. This will help. Okay. Here it's not life-threatening. It could be life-threatening, but it's better to say it's a serious condition and needs hospital treatment. Yeah.
Yes.
Shocked. He's not shocked. Okay.
Okay.
Just these little corrections, and everything will be fine and good. Okay.
Thank you, doctor, for your feedback.
Thank you, Dr. Yumna. Yes. Any question in this case, doctors? Any question? This case, some of you will just tell, well, your condition is serious, or from what you have told me, I am, you have something, or I'm suspecting something called injury to the brain, and this is emergency, and we need to admit you in the hospital and do CT scan. Are you following so far? Okay. And then the patient tells the doctor, well, doctor, it's just headache, everything is okay, I just need to go home. Then he tells him, well, Mr. X, as I mentioned, this is a serious condition, and it's important, and you have to stay in the hospital. Without showing any sympathy, any empathy, any part of communication skills. Maybe they they are hesitant to give the management. Okay, Mr. X, from the information you have given me and from the examination, I am suspecting something called injury to the brain. Unfortunately, this is a serious condition, and you need to be treated in the hospital. We will do a CT scan on your head, and we will involve the neurology team, and we will give you a painkiller for your headache. Are you following me so far? What would you say about this way of management, doctors? He said everything. He said everything. That this is serious, injury to the brain, CT head, neurology team, painkillers. He said everything. But what is your judgment about this way of management? Robotic? Yeah, I do agree with that. What else? Not any chunks. Yeah. What else? Are you happy with this performance? Any one of you here is happy with this performance? The doctor said everything. The doctor said everything. Dr. Rufaida, oh dear, typical me. How to improve, please? How to improve? By practice. By practicing. And before practicing with your colleagues, you have to practice with yourself in the mirror. Sit down in front of the mirror, okay? and use the what? The index of the cases. Okay? I am going now to practice on neurology cases. Okay? The first case is head injury in an adult patient. Sit in front of the mirror. Okay? And say to yourself, well, Mr. X, I'm afraid that you might have an injury to your brain with fracture as well. This is a serious condition. Are you following me? At first, you will find yourself robotic. You will find yourself that you are not satisfied by everything that you say, but every day, day by day, you will find the difference. And believe me, this will happen. You will find the difference day by day. Practice just 10 minutes every day before you sleep in front of the mirror. Next day, practice on what you have learned. Okay? And record yourself. Listen to yourself and say, oh well, okay, I did say that correct. That's good. But this was not convincing me. It was not good. Okay, practice on it today in front of the mirror with yourself. Okay? You will find the difference. Dr. Rufaida, did I manage to address your concern? Believe me, if you don't do that, you will not find any difference. And if you are in this stage without practicing daily, you will not find any difference. Okay? Practicing with your colleague and with yourself. All right, let's move on to the next case, doctors. Doctor.
Doctor, you didn't say, will that affect the mark? You didn't say what's wrong with this. It's monotonous.
Definitely, the patient will have you mean me?
Yeah, when you simulate, yeah.
All right. At least he will take one.
Okay. Even if he said everything in the management?
Yeah, he didn't address the patient concerns. He was monotonous. The patient was not happy. Maybe sometimes from the stress, he doesn't even ask the patient, why do you want to go home?
Oh, yeah.
From the stress, and it happens. All right? So no communication, robotic, just gave the medical treatment, didn't show proper communication with the patient. He will take one, maximum two in the management. And those people just go out. I did everything in the notes was written. I did it. I said it. Why did I get low marks? Well, you say, will he take high marks in this management? No.
Yes, okay. You're right. Okay, thank you, doctor.
Thank you. Okay. The next case with Dr. Yasmin and Dr. Mariam. Ready? Dr. Yasmin and Dr. Mariam, are you here, doctors? Dr. Mariam, yes, and Dr. Yasmin? Let's start by Dr. Mariam first, and then we see where is Dr. Yasmin? What was it, Dr. Yasmin? Was it Dr. Yasmin, doctors? Yes, Yasmin. Yeah. Okay. Listen carefully. Okay? You will have 3 minutes. Adam, 40 years old patient. The patient had laparoscopic cholecystectomy yesterday. Surgery went well. The patient has shortness of breath, sudden, half an hour ago. Otherwise, everything was okay, just shortness of breath. From the point of the past medical history point of view, patient is fit and well. Okay? Examination. Normal vitals, bilateral basal lung crackles, bilateral ankle edema, no investigations done yet.
Okay. I don't know the diagnosis, but I will try my best.
Try your best.
Okay.
Do you want me to discuss the management with everyone here and then you can practice?
Maybe I can try first because in the exam maybe I face a new case and I don't know what to do. So
Okay, that's you know, a valid concern and a valid
okay.
rationale. All right? Yeah.
Okay.
Okay. Yeah.
All right,
You
Mr.
have
Adam.
3 minutes. Just
Okay.
starting from now.
All right, Mr. Adam, thank you for letting me examine you. Now, I can say that from what you have told me, the fact that you are having now a shortness of breath, and after examining you, I have found that you are having some swelling in your lower legs. And when I've examined your chest, I found that you are having some problems in your chest. And all of this make me suspect that, and after doing the operation, make me suspect that you're having maybe something related to your heart. Are you following me?
Well, I'm following you, doctor. What kind of thing going on in my heart?
Well, maybe it's maybe you're facing some problems in your heart or lungs after the operation, because after the operation you might experience, when we suspect that there's a shortness of breath, maybe you're having like a pulmonary embolism, or that it means that you're having a clot in your lungs, and that's why you are feeling this shortness of breath, or maybe it's something related to your heart that's causing the shortness of breath and the lower legs swelling.
Okay, doctor.
Well, at the moment,
What are you going to do for me?
well, at the moment, we are going to do some investigations. At first, we are going to involve the heart and lung specialist, and after that, we are going to do some investigations such as a chest X-ray, and if it came back normal, it's a scan to your chest, and if it came back normal, we might do also a CT pulmonary angio. It's a kind of scan to exclude any clot that's found in your chest. And after involving the heart specialist, he might do some heart tracing, and he might also consider doing an echo. It's a heart scan. So am I clear so far?
Okay, doctor. So why did I get this thing, doctor?
Well, maybe it happens because of a complication from the operation that you have recently done. So maybe this is a condition. I'm really sorry for that, but please don't be worried. We are going to manage this. So rest assured, and at the moment we are going to give you an oxygen because the shortness of breath that you are feeling, and that will make you quite comfortable.
Okay.
Okay.
Yeah.
So and for the lower leg swelling, we might give you
Time's
a
up.
water pill. Okay.
Okay. Time is up. All right. Thank you, Dr. Yasmin. How do you feel? Dr. Whom?
Marian.
Dr. Mariam. How do you feel?
Well, I'm not sure. I feel like I was hesitant because I didn't know the diagnosis.
Okay. A little bit. All right. But not to the extent that it affects your confidence. I mean, you were confident, okay, but you were not having a good grasp to the station. Okay?
Mm.
Okay. Did you practice before?
Yes.
Okay. How much did you practice, or where you are in your preparation so far?
Well, I practiced usually every day, but one case, maybe two cases, just.
Okay. All right. All right. And when is your exam?
Well, at 10th of February.
February.
Yeah.
Okay. All right. All right. 2 cases daily is not enough. All right.
Okay. All
Um,
right.
at least 5 to 6 cases for you and for the other partner. Okay. So
Okay.
minimum 8 to 10 cases. 8 to 10 cases for both of you. All right.
All
Um,
right.
this is the bare minimum. Okay, with your partner daily. Okay, 1 or 2
Okay.
cases is not enough at all. Yeah. Okay.
Okay, doctor.
This will expose you to different situations, different concerns, and different cases. If 1 or 2 cases a day, you will be less exposed to cases. Yeah.
Okay.
Uh,
Thank you,
okay.
doctor.
No worries. I'm going to comment, but I'm happy that you took the decision to practice with me and to get a comment, which is really, really appreciated. Okay.
Okay, thank you.
All right. No worries. The next doctor is Dr. Yasmin. Are you here, Dr. Yasmin?
السلام عليكم.
Yes.
انت قاصده ياسمين شيخ الدين ولا في ياسمين في الليسته عندك يا دكتوره بعد
Yes.
اذنك؟
Yes. It's written Yasmin in the list. I am not sure who is Yasmin, but if you are Yasmin, then we can take Yasmin.
Because this is the first time for me to join your
All right. And how
session.
did you find everything?
Everything is fine. Thank you
Okay.
very much. Sorry for
Okay.
my voice.
No, it's fine. It's totally fine. Do you want to practice before we talk about the management, or would you like us to discuss the management first and then you practice?
I can try. This is my first time to practice.
Okay. When is your exam?
I didn't book yet, but my plan for the last week of March.
March. Okay. All right. Okay. So, yeah. Did you hear the? Did you listen to the findings?
Yeah. Adam, after cholecystectomy, he developed shortness of breath. He's fit and well,
Mm-hmm.
normal vitals with bilateral basal crackles and bilateral ankle edema. No investigation done yet.
Yeah. Okay. So you can start 3 minutes from now.
Okay. Thank you, Adam, for letting me examine you. After what you told me, we found that there is a bilateral uh, cracks coming from your chest, and also there is bilateral swelling in your ankles.
Mhm.
And as you told me, you did an operation to remove your gallstone. Uh, Based on that, we are suspecting a condition called pulmonary embolism. Are you ever hear about that?
Palmo- no, doctor. What's going on with me? What's that?
Uh, Sorry for medical term. This condition sometimes happen after operation. Small clot form in your blood vessels in your lungs, and this causing this shortness of breath you are experience. Are
Okay.
you understanding me?
Yes, doctor. What are you going to do for me now, doctor?
Fine, that's a good question. Uh, Now we need to run some investigation to be sure what's happening.
Okay.
After that, and I will provide you with oxygen to ease your breath.
Okay.
And if it's come positive to what we are thinking about this clot, we will give you some medication to dissolve this clot. Are you willing to do that?
What medication, doctor?
medication are blood thinning medication.
All right. Okay. And why did I get it, doctor?
Sometimes it come after operation, leading to formation of this clot, and in some other cases it come after long flight or using of some medication. But in your condition, the most probably due to the operation you did before.
Okay.
Do you have any concerns?
Uh, no, doctor. No.
That's fine. Do you have any question so far?
Uh, no, no, thank you, doctor. You've covered it all. Okay. All right. You still have few seconds. Okay. All right. So, how do you feel, Doctor? Doctor Yasmin.
Yes, me. I feel I'm not sure about my performance because but this is what come in my mind when I hear the story.
Okay. All right. Okay. Both of you told me the diagnosis partly. The patient has sudden shortness of breath after a surgery. So sudden shortness of breath after a surgery. It's pulmonary embolism until proven otherwise. Right? Okay? But the patient has bilateral lung crackles and bilateral leg edema. What is the explanation of that?
Could be pulmonary edema.
Yeah, heart failure. Yeah, acute heart failure. Acute heart failure. So he has two things, and must to be for everyone here to be aware. Massive pulmonary embolism can lead to acute heart failure.
Doctor, that's why actually I was confused because he came with a lung crackles and lower leg edema, so I was not sure about the diagnosis, whether it's a pulmonary embolism after the operation or a heart failure.
Well, we can't say heart failure without saying pulmonary embolism in this particular case. Okay.
Yeah,
yes,
I didn't know that. All right.
He has the signs of heart failure, okay, or pulmonary edema. But what caused that? In a fit and well patient, the patient doesn't have any kind of heart diseases before, any symptoms of any signs or past medical history of heart conditions, or even hypertension.
I didn't know that pulmonary embolism could lead to heart failure or acute heart failure.
Massive one can lead to acute heart failure. Okay.
Okay.
So the patient has two problems. Okay. Pulmonary embolism led to heart failure. Okay, this is your diagnosis. This is the first thing. Yeah. Where is that? Yeah. So this is the diagnosis. What's your immediate? So we have to think about immediate, ongoing, and future. This condition is emergency, right? This condition should be treated right away. Yeah.
Yes, doctor.
What's your immediate action now? If you think about it, well, okay, this patient has pulmonary embolism and signs of heart failure. What led to the heart failure? The pulmonary embolism. Do I need to confirm that this is pulmonary embolism and heart failure? Yes, I have to do investigations. Cardiac enzymes, BNP for heart failure, ABG, ECG, chest X-ray, CTPA. All of these should be done to the patient. Okay? The patient should be on low molecular weight heparin.
I mentioned the water pills, but at the end of the consultation.
The patient should be on low. If you don't give low molecular weight heparin treatment dose for this patient, you are not safe doctor. If you diagnosed pulmonary embolism and you don't give low molecular weight heparin treatment dose for this patient, you are not safe doctor.
So do we give it after the chest X-ray came back normal or after the
Once
CT
you
pulmonary injury?
suspect, you are suspecting pulmonary embolism, and this is a strong suspicion. Okay, the patient has surgery, sudden shortness of breath. All of these gives high well score. The patient should be on low molecular heparin treatment dose until proven otherwise. Okay? Low molecular weight heparin, furosemide, and monitoring. If you are not able to do all of that, your management will be very low. Okay? In addition to answering the patient's questions. Alright? The patient told you, what are you going to do for me? Well, we will do further investigations, some investigations on your heart, and some bloods, and heart tracing, chest X-ray, and a specific scan on your lung to find do you have a clot or not, called CTPA. Okay? We will start you on blood thinners and water tablets through your medication, like water tablets, but through your vein to ease this shortness of breath. Okay, this is what are you going to do for me. Why did I get it? Why did I get it? What is the answer? Well, it is a well-known complication after any surgery. Dr. Mariam didn't answer me this question. Okay?
Doctor, I thought I said maybe it happens because after as a side effect after the operation.
You said after the operation. You didn't explain, okay, after the operation. What happens after the operation? This is a complication. This is a well-known complication from the surgery. So this is the meaning of answering the patient's concerns correctly and properly. Okay? You might think that I've answered, but in reality, the patient didn't understand. Okay?
Okay.
Right? So you have to be specific while you are answering. Dr. Yasmin told me, well, it is a complication from the surgery. Sometimes it's because of the long journey, or it's not relevant to the case. So don't go into that. Don't be irrelevant. Okay, Dr. Yasmin? Are you with me, Dr. Yasmin? You explained that this is a complication from the surgery, which was good. All right, and more than enough. You don't need to talk about the other risk factors.
Okay.
Okay?
Okay.
Okay. So the management should include both of the diagnoses. Mr. X, I'm concerned about the signs and symptoms that you have. We have found you have sudden shortness of breath. If you would like to summarize, it's okay. If you don't want to summarize, tell him, from the signs and symptoms that you have, I am suspecting that you have something called pulmonary embolism. Have you heard about this before? Yes. What's that, doctor? It's a clot in the lung, and this clot led to some damage to your heart in a condition called heart failure. This is if you would like to say something very simple without making an effort. I don't prefer that, but if you say that, it's okay. Alright? Simple, easy, 2 sentences, and that's it. Okay? Or you can tell, Mr. X, you have this sudden shortness of breath. When I examined you, I found some abnormal sounds in your lung and swelling in your legs. all of these are suggestive of something going on with your lung and your heart. You might have a clot in your lung. This clot led to affection of the heart ability to pump. That's why you have this shortness of breath in a condition called heart failure. So we have used this one and this one. Use whatever you prefer, but be confident, be simple, be understandable. Alright? Immediate. For now, this is a medical emergency, Mr. X. We need to do some further investigations. Some bloods for the heart, and check the function of your lungs. Okay? ECG, heart tracing on your heart, chest X-ray, and a specific scan called CTPA to confirm or exclude if you have clot or not. Meanwhile, we will start you on blood thinners urgently and some medication, or a medication called furosemide. It's like the water tablet but through your vein to ease this shortness of breath, and we will keep monitoring you. Do you have any question? Yes, doctor, why did I get it? Well, Mr. X, this is having a clot after a surgery. It's a well-known complication after any surgery. Okay? And the affection of heart, most probably because the clot is massive or big enough. Okay, don't worry, we are here to help, we are going to support, we are going to do our best. Just give me a second, doctor. Yeah, we are here to help, we are here to support. The good thing that you are with us in the hospital, we will do our best to help. Don't worry, you are in safe hands. Some support, some supportive words. Okay, if you are not able to do all of that, believe me, management is incomplete. If you didn't suspect pulmonary embolism, you are not a safe doctor. If you treat it as a heart failure only, you are not a safe doctor. Alright? If you don't give low molecular weight, you are not a safe doctor. Yeah? If you don't answer the patient's questions correctly, you will get low marks in the management. If you didn't show support, if you didn't reassure the patient, if you scared the patient, Mr. X, this is a serious condition and we have to treat it right away. You have a life-threatening condition and you might die at any point now. We have to give you this treatment to save your life. Oh my God, am I dying, doctor? You might just lead to heart attack to the patient. Okay? All right, Dr. Mariam, you gave the diagnosis partly, okay? You have a misunderstanding of the investigations done by whom, okay? You told me we will involve the lung specialist and heart specialist. No need for lung specialist here. The heart specialist is important to for an echo, okay? Yeah, if you don't mention it in this specific situation, it's fine. All right, you did your job. You investigated, you gave the low molecular weight and furosemide. Good, perfect. All right, you have time, you have to give yourself a time to explain things and to answer the patient concern. you might not have a time to give the further management or the ongoing and further management. Okay? The ECG should be done by yourself. The ECG should be done by yourself, not by the heart specialist. This is your job as an FY2. Okay? You didn't give me low molecular heparin. You gave me furosemide at the end. Both of you gave me oxygen. Why? The vitals are normal. The vitals are normal. Not everyone who has shortness of breath needs oxygen. Not everyone has shortness of breath needs oxygen. If the oxygen saturation is 94 and above, no need for oxygen. Okay, doctors? No need for oxygen in this case, unless the oxygen is less than 94%. Okay? This is for Dr. Mariam. Dr. Yasmin, please avoid medical jargons. You said bilateral, crackles in the lung, and bilateral. The patient doesn't know what is bilateral. Okay? And what is crackle? Abnormal sounds. Okay? You gave me oxygen, it's not needed. You didn't monitor me, you didn't give me furosemide. And the answer for the question, partly relevant and partly irrelevant. Okay? So I think we have compared and we know now what is the perfect management, and if you want to add here heart specialist and echo, perfect. If you don't have time, you did the wanted thing. Yeah? Alright, Dr. Ahmed, may I ask how both heart failure and PE with normal... Well, okay. The patient usually will have low oxygen, okay? But you have a finding now. You have a finding. Vitals are normal. Don't assume things, okay? You don't need to give oxygen if the oxygen is normal. If it's something, not going with your logic thinking, it's okay. But you have a finding now, and you have to deal with it, okay? And most of the time, you deal with cases that are totally strange. How did that come? How did that happen? You try to think from here and there and there and here, and it happens, okay? Deal with what you have. Deal with what you have, okay? And be a safe doctor. Did I answer your question, Dr. Ahmed? Doctor, the CTPA done by me also, and don't need a lung specialist. Well, not a lung specialist. It doesn't need lung specialist. It does need a permission by the consultant. But you as a doctor, you can order it. Okay? You can order it under the consultant's name. Okay? If you say CTPA without involving the specialist, it's totally fine. Okay? It doesn't need a specialist. It needs a consultant permission. But you can order it by yourself. Did I answer your question, Dr. Mariam? Did I answer your question, Dr. Mariam? Yeah. So if I give you an advice, Dr. Mariam, just try to understand the system. Okay? Who does which and which done by whom and these things. Okay? Alright, let's do the last case. We can repeat the cycle. Dr. Noor and Dr. Yumna. Ready, Dr. Noor and Dr. Yumna?
Yes, doctor.
Alright, yeah, let's do the last case. Emily, who is going to start? Dr. Yumna or Dr. Noor?
Okay, I'm available. So,
who is that?
Yumna.
Dr. Yomna?
Yes.
Okay. And Dr. Noor? Is she here? Dr. Noor? Okay, Dr. Noor is not here. We can pick either Dr. Yasmin or Dr. Aya. Dr. Aya, I've called your name. I've called your name earlier, but you didn't answer. Okay, if your name is in the list, I can pick you up. Okay?
Okay, doctor. I'm sorry, I didn't
No,
notice.
worries. We start sharply, okay, every time. So please, just attend sharply, just to avoid wasting of time. Okay? All right, Dr. Yomna and Dr. Aya. All right, Dr. Yomna. Amali. Okay?
Yes.
She is 35 years old patient. Came to check her results. She has high LH and normal FSH. The ratio between LH and FSH is 3 to 1. Okay?
Mm-hmm.
She has mild acne or acne. She has acne and amenorrhea for 6 months. No past medical history. She has family history of same problem, acne and amenorrhea. She's gaining weight. Personal history, she eats a lot. She doesn't exercise. She doesn't smoke. She doesn't drink alcohol. Examination, body mass index is 32. The acne is mild acne.
Okay.
Right?
Mm-hmm.
Okay. We can start 3 minutes from now.
Okay, Amelie, thank you for letting me. I have note that you are coming today to know about your results. Is that okay? Is that right?
Yeah.
Okay. Okay, Amelie, from the lab tests that we done a test for your hormones. Okay, and the results came that the percentage of your hormones is not as normal as it should be.
Okay.
Also, that comes with your symptoms that you have told me before. All are suggestive of a certain condition called polycystic ovary. Have you ever heard about this?
No, doctor, what is that?
Okay, Emily, sometimes our ovaries have like many more sacs on it or follicles. We mention that term. Okay, that increased number will be suggestive for your symptoms. Okay,
Okay.
so we can do further images like ultrasound on your ovaries to just make to be confirmed about this condition. Also, we can manage this condition right away by talking about some things that we can do for you and some things that you can do yourself. What do you think about this?
Yes, I can do. I can discuss all of that. But why didn't I get my period, doctor?
Okay, well, that's a valid question. I can understand you. Um, well, with this condition, the periods might be irregular or like not that naturally regular. So we can by medication we can regulate this period, so it will be normal ongoing days. What do you think about this?
Okay. All right.
Mhm.
So what are you going to do for me now, doctor?
Okay, well, regarding your acnes, we can provide you with like topical antibiotics or creams Okay. And also for your periods, we will give you medications like contraceptive pills, but we should ask about the pregnancy and this all in the history taking questions, but we can give you like pills like the contraceptive pills, and we will teach you exactly the days that you should take and the days that you should stop.
Time's up. Okay. All right. Thank you, Dr. Yomna. How do you feel?
Not good actually, but okay, we will learn.
Okay. You missed the most important thing.
Mm-hmm. The lifestyle or
Losing weight.
the lifestyle, I should mention it in that thing that you should do yourself, but you have asked about the things that I will do for you.
Yeah.
So,
And I'm happy that we have done the case now. I'm happy that you didn't reach the lifestyle modification or you didn't reach the weight loss. This gives everyone here an idea about management of data gathering. This case needs time for management.
yes,
We have done the management in 3 minutes and it didn't give us time for that.
to reach the cornerstone thing, yes.
In data gathering, you have to be quick as possible as much as you can. Okay? Since when you have these, are they getting worse? Any family history of similar condition? Can you tell me about your lifestyle? Do you eat a lot, or can you walk me through your diet? Yes, doctor. Blah blah blah. All right. And do you exercise at all? No, doctor. Or yes, doctor. Whatever. Okay. Smoking
Yes.
and alcohol are not important at all in this case. All right. So if you don't ask them, it's fine.
I have to search about the risk factors here, so that's
Okay.
why.
That's it. And move on to concerns and explain right away. Please, doctors, do not waste time. This case is extremely tricky in its management. And if you think that you are running out of time, start by losing weight, please.
Okay. Logical. Yes.
Okay? All right. Let's do the next performance with Dr. I'm going to tell you the comments on your performance, but let's do the case with Dr. Aya. Ready, Dr. Aya?
Yes, doctor.
Okay. Do you want me to repeat?
Just the test result, or no, the symptoms that she has.
She has acne and amenorrhea for 6 months. She eats a lot. She doesn't exercise. She doesn't smoke or drink alcohol. And her body mass index is 32 and she has mild acne.
Okay.
Start.
Thank you, Emily. Thank you, Emily, for answering my questions. So I have your test result here with me. As you can see that there is an increased ratio in the hormones, which is called FSH and LH. Okay. And also taking in consideration your symptoms and the test result, I'm suspecting that you are having a condition in your ovaries. We call it polycystic ovary syndrome. Have you ever heard about that?
No, doctor, what is that?
Okay, let me explain to you. It's a condition of the ovaries that it having have multiple cysts. Okay, that lead to disturbance in the hormones released from the ovaries. That's why you are having this amenorrhea and acne. Am I clear so far?
What is amenorrhea, doctor?
That you are having the periods stopped.
Okay. So
Sorry.
Yeah, this is my question. Why didn't I get my period until now, doctor?
I can see how this concerned you. So, actually, because of the multiple cysts in the ovaries, it lead to abnormality in the function of the hormones that is released from the ovaries. That's why the period stopped.
Okay, all right.
But
So
let
what
me
are you
assure
going to
you,
do?
okay. What are you going to do? We have a lot of options. Okay. Regarding first regarding your this period, what concerns you the most? What would you like me to start first?
Whatever you want, doctor. I just need to get my period and any treatment for acne, doctor.
Okay. Okay. Regarding the acne, we can offer you a cream medication. Okay. And also regarding the period, we can offer you give you a tablet. Okay. It's called combined oral contraceptive. You can take it and every day and skip this. And after that, after the you finish the bags, you will have the period.
No, doctor. I don't want any medication. No, doctor. Thank you.
I can see that you don't. You are not willing to take tablets. Do you prefer any other, like any device intra womb put in the womb
No,
device?
I don't want medications for now.
Okay, so actually, first we would like to run an ultrasound to the womb to make sure of the diagnosis first. Okay,
Okay.
and also we would like to do blood test to about thyroid function test and also prolactin level. Uh,
Time's up. Okay. How do you feel?
not good, sure. A lot of things we have to say, but I didn't. A lot of things actually.
Okay. And do you think you can just tell the patient, well, the main treatment in your condition is losing weight. If you lose weight, you can get your period and the acne will get better. But we can also give you other medications.
After, if the condition is confirmed by losing weight, maybe she will get all the symptoms.
So what I'm talking about, what I'm trying to ask you, Dr. Aya, would it be better to tell the patient, well, the main or the cornerstone in the treatment of this condition is losing weight. I can see your body mass index is in the higher side. If we lose some weight, you can get your period again, and you can the acne will get better, and we can help you with other medications. Is this better than telling her we will give you medication and we will do ultrasound and blah 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 and waste the time and don't talk about the cornerstone of the management?
Yes, that will be better. Yes.
Okay, so always think about how you manage your time correctly and how to say the important things within the time frame that you have. Okay?
Okay, yes.
So, in this case, I'm going to discuss what is the management in this case, and then we can talk about how what Dr. Aya did and Dr. Yumna. Alright, what is the diagnosis, or what is the explanation? Polycystic ovarian syndrome. Most probably this is polycystic ovarian syndrome. Okay? How to explain? If I'm running out of time and I want to give time extra to management, I tell, well, Mr. X or Mrs. X, Emily, I have the investigations with me. There are some hormonal disturbances. This pattern is suggestive of what's called polycystic ovarian syndrome. Have you ever heard about this before? It's a condition that affects the ovaries in the reproductive system. The ovaries is full of fluid-filled sacs. It led to hormonal disturbances and the symptoms that you have. Done. Without explaining what is LH, well, LH and FSH, and you have this and don't waste your time. Manage it smartly. Explain it smartly. Okay? Did I get more than a minute in explaining that? I think half a minute. Right? Okay? I explained it simply. Explained to her what is the diagnosis, what is polycystic ovarian syndrome, and what could be the hormonal disturbance. Okay? Both of you didn't explain the polycystic ovarian syndrome very correctly. Cysts, maybe the patient doesn't know what is cyst. Okay? Dr. Yumna, you need to improve yourself in explaining the polycystic ovarian syndrome. I didn't get what you were explaining to me. Okay? So the ovaries are, in this condition, are filled of fluid sacs. It causes hormonal disturbance and the symptoms that you have. As simple as that. Alright? Okay, Dr. Yomna?
Yes, doctor.
Yeah, more work on explanation of the polycystic ovarian syndrome. Then, what is the immediate treatment, or what we can do as doctors? Referral to ultrasound and treatment of acne and amenorrhea. You can give medications for acne and amenorrhea, topical for mild acne, topical retinoid. Topical retinoid is okay for mild acne, or salicylic acid. Okay, amenorrhea, cyclical hormonal treatment. Okay, you can say COCP, which is okay, but for amenorrhea, they give cyclical progesterone, not COCP as a COCP. Okay, hormonal treatment, and it's written in the map, hormonal treatment, not COCP. Okay, and now the most update for polycystic ovarian syndrome, COCP is an off-label use in polycystic ovarian syndrome. If you say it, it's fine, but I'm telling you what is the most updated thing in the management.
Can we just tell like contraceptive pills, not any type of it, or?
You can, but it's better to, usually contraceptive pills, you know, it comes like a contraception. Okay, hormonal treatment is better, but if you can say it's fine, it's not a problem. But I'm telling you
The
what
right.
is the
Yes.
meaning. Yeah. Okay.
Yes.
And what is the most update in the COCP? All right, Dr. Yasmin, no, Dr. Aya, you didn't say referral as for ultrasound. You said it lately. Okay, so there was a bit of disorganization. Okay.
Yes, start the investigation first.
Yeah, I told you I don't want medications. Then you told, well, we will do ultrasound first and refer you, blah blah blah, and then we can treat. Just be aware of your organization of thoughts. Okay?
Yes.
So this is the immediate treatment. Referral to ultrasound to confirm or to exclude, and we can offer you some medications to treat the symptoms that you have. You can say that as a kind of frame. Yeah? But the main treatment line or main line of treatment in this condition is losing weight. Your body mass index is a bit high, and most of people with this condition, when they lose weight, everything gets better. They get their period, and the symptoms that they have, even acne, can get better.
Yes.
Okay? When I asked why didn't my period come, Dr. Dr. Aya told me because of the you explained a lot. Okay? Yes, I understand. I understand what you mean, but it's better to tell because of the hormonal imbalance. That's it. Okay? Don't explain too much. You have time to, to manage. You have many things to do. All right? You didn't get your period because of the hormonal disturbance that you have. Because of this condition. Okay?
Okay.
The same to Dr. Yomna. Okay? To the point, please. To the point. She doesn't need to take any medication. Then you tell her, well, okay, it's fine. It's totally fine if you don't want to take the medication. The main treatment is losing weight. We can start with losing weight. We can help you in losing weight, and then we can take it from there. We will follow you up, and I can give you leaflets to read more about this condition. Okay? Questions. She might raise some questions. Will I get pregnant? I didn't get. There were no time to ask more questions. Will I get pregnant, doctor?
Fertility.
What
I
is the
offer
answer?
fertility clinic. Fertility clinic. I will refer you to a fertility clinic.
This is not listening. Sorry, but I say that my question is, will I get pregnant?
Yes.
My question is,
Sure.
will I get pregnant?
Yes, sure. You can be pregnant as any other woman.
That's it. Okay? Listening, please. Okay? Listening. All right? Don't be irrelevant and don't just mention what you want to say as you learned in the notes or wherever. Okay?
But doctor, as long as she's not getting the periods, she cannot be pregnant at this period until the periods will be returned, right?
Can she get pregnant? Will I be pregnant? Will I be pregnant? Yes, you can. If you follow the strategy of treatment, you can get pregnant. And most of people who are losing weight, they return the ability to get pregnant.
Okay.
All right? So her question, will I get pregnant? Yes, you can be pregnant. If you follow the strategy with losing weight, you can get pregnant. If she asks you, what if I don't get pregnant, doctor? What's your answer then?
We will refer you to a fertility clinic.
Yes. If you didn't get pregnant after that, we can think about other options, maybe referring you to the fertility clinic.
Okay.
All right? So, again and again and again and again and again and again from here to the moon. Listen carefully to the patient's concern and answer them correctly. And to the point, please. Do not go around the bushes. Okay? To the point. Why did I get my period? Because of the hormonal imbalance. Will I get pregnant? Yes, you can. Okay? So, be specific. Yeah?
Yes.
All right. Let's see the questions and then we can finish our session. Before anyone goes anywhere, please participate in this poll. It's extremely important for everyone here and for me. Okay? 3 questions. Write down your satisfaction. What did you like? And what are your suggestions for the future sessions? Okay? It's extremely important, please. Let's read the questions. Dr. Ahmed, Doctor, I put my name, yeah. Can I tell him the most important one while giving the frame of management at first, like things you will do like losing weight, then I'll illustrate up? Yes, you can, Dr. Ahmed. Yes, you can. Why not? I like frames. I like, and this is the you know what I say, the cornerstone of my course. Okay, giving frame first and then talk in details. Okay, manage your time. Yeah. You can tell her, well, okay, there are things that you can do and things that we can do, and the cornerstone is what you can do, which is losing weight, and we can talk about that in a minute. All right. In addition to the medication that you are going to take, if you would like, and following you up with giving you some leaflets about this condition. Which one would you like to discuss? Give a frame. Yes. And it's better every time to give a frame. Is this a question or fact, Dr. Ahmed?
Even I'm not having the much time.
Sorry?
Even I haven't the much time to do so.
If you don't have the time to do so, yes, give a frame and highlight the important points that you would like to discuss. Okay? Things that we can do in terms of giving you medication and things that you can do in terms of losing weight.
Okay, thank you, Dr. Fah.
All right? So all depends on the time management, and all depends on the smartness of managing your time and managing the important point that you are going to say in the 8 minutes. Okay? This gives you a conclusion that you maybe don't pass the cases, and maybe you don't manage to get high marks in the management just because the lack of time. Because taking too much data gives you less time or lesser time in the management, so you don't have the time to explain things better to the patient. You don't have time to say the important points in the management. Okay? All right. Any other questions, doctors? Any other questions? I can see people just are satisfied from the session. Yeah, 5 from the satisfaction. I'm happy with that. So did the session meet your expectations, doctors? Did the session meet your expectations?
Yes, doctor. Thank you very much, actually.
Okay, that's good. That's good. And this is my aim, because most of the doctors don't have this insight about the management. They think that we have to say few things and everything is okay. No, it's about many things, a holistic approach. What if I say wrong diagnosis, name, but done all the other parts, IPS safe advice? If you give wrong diagnosis and the treatment is correct, sometimes the diagnosis is wrong, but the management is correct, reassuring and follow up, okay, then you can get the mark of the management, okay, but you will have a tick in the diagnosis and you might lose 1 mark. All right, so all depends on the situation and the case itself. I cannot say yes or no exactly, but in some cases, yes, it happens. Okay, any other questions, doctors? Any other questions? Okay. All right, so thank you for attending, thank you for listening, thank you for participating, thank you for making the session useful with your discussions and questions. Hopefully the next session we can arrange for the ethical management. Let's see what's going to happen, but yes, see you inshallah in the next session. Yeah, bye bye.